Hello.
Hi, how are you?
Good. How are you?
Good.
I'm Junior. I'll be the nurse for today. Can you tell me your name?
Jenna Goldberger.
Okay. And your date of birth?
4/28/96.
Okay, good. Thank you. And you must be...
I'm Alexis. I'm her sister.
Okay, nice to meet you.
Me too.
Alright, so I'm here to teach you about your new medication that your provider ordered. Alright. Your provider diagnosed you with type 1 diabetes.
Can you explain what type 1 diabetes is?
Sure, type 1 diabetes is an autoimmune disease that happens when the cells that produce insulin in your body are not functioning properly. So this results in your body not using glucose that it's needed, because the main source of energy in your body is glucose. So in order to use your glucose, you need insulin, and since your body doesn't produce it, you need your insulin medication, right? Your provider ordered Insulin Lispro before meals 3 times a day to control your blood sugar levels.
Why do I need to take it before meals?
So when you eat, your blood sugar raises, and since you don't want it to raise high, you need to administer your medication to lower it.
Okay. How long do I need to take this medication for?
So since you were diagnosed with type 1 diabetes and your body doesn't produce insulin, which it needs to use the glucose, therefore you will need to take it for the rest of your life. It's a lifelong medication. So
Okay.
do you have any further questions for me?
Do I still take the medicine if I skip a meal?
Okay, so it's important for you to check your blood sugar levels, because if it's too high, even if you don't eat, you might have to take your medication. We're going to provide you with a sliding scale like I told you, and depending on what level your blood glucose level is, then you're going to have to administer.
Okay.
But if you skip a meal and your blood sugar level is low, then you don't need to take your medication. In fact, you're going to need to eat at least something.
Okay, I
Alright.
understand. Thank you.
Wait, so how does this medication work?
Okay, so the Insulin Lispro. So basically, in type 1 diabetes, the glucose is staying in the blood. It's not being used by the body. And since it's the main source of energy for the body, it needs a transporter. So basically, the insulin is a transporter. It lowers the blood sugar levels by absorbing it to the rest of the body for energy.
Thank you.
No problem. Alright, so with this medication, it's important for you to understand the adverse reactions to this medication, right? So the first one is hypoglycemia. It's low blood sugar levels, below 70 milligrams per deciliter. And so you need to monitor if you feel like any drowsiness, confusion, weakness, fatigue, any like abnormal hunger, trouble concentrating, things like that, or even like if you feel like fainting. So you need to monitor with that. That shows that your blood sugar level is too low. So you're gonna have to have a quick acting sugar in order to prevent that, right? And then the next adverse reaction is an allergic reaction. It's possible for patients to have an allergic reaction to insulin. So you need to monitor for like any redness or like swelling at the injection site, an itchy rash that may appear in the entire body, or like trouble breathing, signs of like an anaphylaxis reaction, fast heartbeats, feeling like you might pass out, and swelling in the throat or like tongue. If you suspect that an allergic reaction is occurring, it's extremely important for you to call 911,
Okay.
because the best treatment is prompt medical care. The next one is lipohypertrophy. That's when, as a result from you injecting the medication into your skin, what can happen is a lump under the skin caused by the accumulation of extra fat at the site of subcutaneous injections. Since insulin must be given subcutaneously, it's extremely important to rotate the injection sites to prevent damage to your skin, and also avoid injecting the medication near your belly button. You need to have like a 2-inch diameter
Okay.
from the distance from the umbilicus. And the last one is hypokalemia. So what insulin also does is promotes the absorption of potassium in your blood to your body. So you need to monitor for signs of hypokalemia, low potassium levels, and that includes dry mouth, muscle weakness, numbness and tingling, muscle cramps, heart rhythm changes. If you feel any palpitations or like flashes or sweats, it's important to call your healthcare provider if you suspect low potassium, because it could really cause fatal abnormal heart rhythms. Okay.
Okay.
What should we do if her blood sugar's really low?
So if her blood sugar is really low, that means it's less than 70 milligrams. Basically, you need to have like a fast-acting sugar agent. For example, orange juice has a lot of sugar. Sugar cubes, non-diet soda has a lot of sugar. Or glucose tablets, you should use that for your blood sugar to raise. And after that, you need to have carbs. So you want to prevent rebound hypoglycemia, such as pretzels, yogurt. Those are good carbs to have.
Okay, I'll make sure I always have one on me.
Okay, good. So do you have any further questions about type 1 diabetes or your medication?
My culture requires me to fast a few times throughout the year. What would I do about my medication on those days?
Good question. So if you're a part of a culture that fasts, it's really important for you to monitor your blood sugar levels. Technically, every 4 hours when you're fasting, you should take your you should check your blood sugar levels. But just to be sure, just to be safe, contact the healthcare provider on the days you're gonna fast. Maybe you might need to adjust your medication administration dosage.
Okay.
Okay.
And what would happen if she didn't take her medication?
So if she doesn't take her medication, what would happen is her blood sugar levels might be too high. That would be hyperglycemia, and that causes a lot of symptoms. Usually the blood sugar levels is elevated about 180, and the signs and symptoms are like increased thirst, headaches, trouble concentrating, fatigue, weight loss, frequent urinating, and blurred vision. So if you see any of those signs or symptoms, it's important for you to take your usual dose of medication to lower your blood sugar levels, and not only that, contact your healthcare provider. And if you really feel unwell, it's never a bad idea to call 911. Okay, so next I'm going to be teaching you how to check your blood sugar levels. This is a glucometer. It measures your blood sugar levels by using a testing strip. This is the testing strip that you attach to the glucometer, and then you put it next to your finger, and it draws up the blood, alright?
Okay.
I'm actually going to demonstrate it for you right now. This is the finger stick. I'm going to use one of your fingers. You're always going to rotate which fingers you use because you don't want to damage your skin, right? So first, you're going to make sure that the finger is clean, nice and dry. You're going to use the finger stick and pinch, squeeze, and then you're going to wipe away the first drops of blood, right? And press it again, and use your glucometer with your testing strip and attach it to it. This testing strip is going to absorb the blood, and now it's going to read it. 130. That's your current blood sugar right now. Okay, so can you demonstrate it for me right now? Okay, I'm going to give you your tools that you need. Okay, so first.
Okay, so first I'm gonna choose a different finger. So
Right.
I'm gonna do this finger. I'm going to prick the side of my finger.
Correct.
And then I'm going to wipe away the first drop of blood.
Yes.
And now I'm gonna take the glucometer with the strip,
Yes.
and I'm going to draw up this blood
Okay.
and
Read.
read my result. My blood sugar is 130.
Okay. And then after, you will always press onto the incision to stop the bleeding. Alright, so now that we measured your blood sugar levels with the glucometer, it's time for your Insulin Lispro. This is the vial that you will need, and this is the syringe. The syringe comes in units, and depending on what your blood sugar level is, you're going to use the sliding scale that we're going to provide for you, and you're going to determine how many units. Since your blood sugar levels was 130, according to the sliding scale, you will receive 2 units of Insulin Lispro.
Okay.
Okay, so first what you want to do is clean the top of the vial with a alcohol pad. This will prevent any microbes from entering the vial. And you will always want to check that you have the right vial. You want to check the name, the dosage, and of course the expiration date. Next, you're going to use the vial and draw up how many units you need. So you need 2 units based on the sliding scale. Next, you're going to remove the safety pin and inject air into the vial. Next, you're going to draw 2 units and remove. Next, you're gonna pinch your stomach. Make sure you choose an area that is nice and clean and dry.
Mhm.
You're gonna pinch, and you're gonna insert in a dart-like motion. And insert
Okay.
slowly, okay? And then just release, and that's about it. So now, can you show me how would you do it at home?
Yes. So I would take an alcohol pad and I would clean the top of the vial. Next, I would take a new syringe and I would remove the safety cap and draw back how much air I'm going to be inserting into the vial. Insert air, and now draw back the amount of insulin I will be giving myself. So 2 units if my blood sugar is 130 right now. Okay, next I would remove the syringe and I would pinch my abdomen and insert the needle in a dart-like motion.
Okay.
And remove the needle and put back the safety cap.
Correct. And just to mention, you will want to stay away from the umbilicus at least 2 centimeters, alright? And every time you inject yourself, always rotate the sides to prevent damage from the skin.
Okay.
And another thing I want to tell you is about Insulin Lispro. It usually takes 15 to 20 minutes to take effect, and the duration of onset is around an hour to 2.5, right? And to take full effect, but the duration of onset is around like 2 to 6 hours.
Okay.
Right. So, but after you inject your Insulin Lispro, it's important for you to eat, because if you don't, your blood sugar level is going to be reduced because of your medication, and so you will need to eat between 5 to 10 minutes after you administer your medication to prevent that. Okay. Do you have any questions for me?
No, that was it. Thank you.
No problem.
Thank you so much.